a full report as to what has been happening for the last week or so that we can actually fix any issues that are occurring in terms of the reporting, the timeliness of reporting, and the batching of test results that has been occurring. So right after this meeting, I have a meeting with Dr. Nandram and the PS to go into a little more detail with that particular event. So Minister Cox, that's my update for this morning.
Thank you very much, Dr. Parasram. At this time, Dr. Mariam Richards, Principal Medical Officer, Institutions, will provide an update on the parallel health facilities used for the national COVID-19 response. Dr. Richards.
Good morning, Minister Cox, CMO Dr. Parasram, and Dr. Rahman, a Veterinary Public Health Director. This morning, I'd like to provide an update on the parallel healthcare system as of Saturday, 8th August 2020. The parallel healthcare system has been the Ministry of Health's response to the COVID-19 pandemic in Trinidad and Tobago. The system itself was activated on the 12th of March when the first COVID-positive patient was admitted to the Cora Hospital in an isolation ward. Since then, the parallel healthcare system has managed thousands of patients in Trinidad and Tobago who are either COVID positive, suspected of having COVID, or have been quarantined. At present today, the parallel healthcare system is accommodating 356 persons. We have 12 patients en route to be hospitalized at this point in time. The capacity of the parallel healthcare system is between 900 and 1,000, and it depends on the allotment of bed spaces and groupings for patients depending on their risk potential. There are several benefits to the parallel healthcare system. The first benefit is that it allows persons to continue their traditional care at the RHA system while keeping them separate from those with COVID-19. That allows persons who have, for example, non-communicable diseases and cancers to really continue accessing care without a disruption in their service. A second major benefit of the parallel healthcare system is that it reduces the infectivity of persons who have COVID-19 and the exposure for those persons, for example, who do not have COVID-19. So these are generally separate, standalone facilities. The third benefit is that the skill mix in terms of human resources for COVID-19 management is matched to the disease and the pathophysiology of the disease. So there are certain specialists that would be present in a greater proportion at a COVID-19 facility as opposed to the traditional hospitals in the RHA system. For example, in the COVID-19 hospitals, we have a greater proportion of anesthetists, intensivists, infection control specialists, and pulmonologists and internists. At the step-down facilities, which are part of the parallel healthcare system, we have a greater percentage of primary care physicians and nursing personnel. The final benefit of the parallel healthcare system is that it allows the ring fencing of allocations. So we have a separate budget and human resources that allows the system to run without really impeding the traditional RHA healthcare system. So as I indicated earlier, the total number of persons in the parallel healthcare system as of this morning are 356 persons. The parallel healthcare system differentiates between COVID-positive patients, suspected COVID patients who are awaiting results, and persons who are being quarantined. That is, persons of an unknown risk potential or who have been exposed to a COVID-positive patient. And I'm sure that everyone would understand the need for quarantining persons and returning nationals over the past 2 months or so. So in terms of the positive cases, we have 2 hospitals right now that have accommodate positive patients. The Cora Hospital, which accommodates persons who are COVID positive but have mild illness or maybe asymptomatic, and there are 34 patients there. And the Couva Hospital, which would take the surge from the Cora Hospital and persons who may be more severe or persons who may have comorbidities. We have 32 patients there with 31 on the ward as ambulatory or ward level patients and 1 HDU patient. Now we also accommodate our COVID positive patients after their stay at the Cora or Couva Hospital, and based on their comorbidities, their age and their symptoms at step-down facilities. And we have 3 step-down facilities that are being used at present. The Brooklyn Center, which has a bed capacity of 32 persons. The Balandra Center, which has a bed capacity of 40. and the Tagarigua Center, which has a bed capacity of 48. At present, only one step-down facility is in use, which is the Brooklyn facility with 20 persons. It is important to note that the step-down facilities may be converted into quarantine facilities depending on the need for such services. Additionally, these step-down facilities, the selection of patients for these facilities is rarely deemed by the clinicians and based on the risk factors. Then we move on to quarantine facilities. So we have two types of quarantine facilities, state facilities and state-supervised facilities. At the Home of Football, which is a state facility, we have 6 persons. The Debe facility is currently empty as of yesterday, and we would have persons who are returning from the UK cohort staying there. We also have persons who may be quarantined at hospitals. For example, if there is a minor and a parent needs to stay with that person. And at the Cora Hospital, we have 2 persons in quarantine, at Couva 3, and at Arima, one of our newest hospitals, the Arima General Hospital, we have 8 suspect cases with 5 on the ward and 3 in ICU HDU. We also recently commissioned the Augustus Long Hospital as of the 6th of August. At present, we have no patients, but I'm aware that we have a couple that are en route from San Fernando. The last category of quarantine facilities are state-supervised hotels. At present, we are utilizing the services of the Chancellor Hotel, Cascadia, Regent Star, and Hilton for CPL players. At the Chancellor Hotel this morning, we have 18 persons, Cascadia 6, Regent Star 57, and Hilton 170. We expect a cohort of approximately 102 persons from the United States. That is the repatriation of returning nationals this afternoon, and those persons will be accommodated at the Paria Hotel. In summary, the parallel healthcare system, as we speak, is accommodating 356 persons with a total bed capacity spread across 4 levels of care of close to 1,000 beds. In this regard, the Ministry of Health continues to have a successful response to the COVID-19 pandemic. Thank you.
Okay.
Thank you very much. At this time, Dr. Saeed Rahman, Director of Veterinary Public Health, will speak on business continuity during COVID-19.
Honorable Minister Cox, Chief Medical Officer, Principal Medical Officer, members of the media, viewing public, good morning. During the period April 7th to June 13th, a period of approximately 3 months, Trinidad and Tobago recorded 10 new cases of coronavirus. As the CMO mentioned, these cases were attributed to returning citizens who were repatriated here. This relatively low number of cases lulled our population into a sense of false security. Consequently, much of the gains made by the ministry in implementation of the many guidelines that we had prepared were eroded. Surveillance of complacence and compliance by our public health inspectors indicated that certain sectors, such as the financial and banking sector, had excellent compliance. Large supermarkets were good, whereas other areas' compliance levels were low. Despite having the necessary equipment for hand washing, signage for wearing of masks, many institutions were now not implementing these measures as recommended in the guidelines. Consequently, we started seeing rises in number of cases locally, with 16 cases reported during the period June 13th to July 12th. And as the CMO indicated, now within the last week or so, we have had a marked increase in the number of cases locally. As a result of that, the CMO has asked that I speak on some of the areas that were touched on before in previous media briefings concerning the need to implement the guidelines that the Ministry of Health has published with respect to different institutions and businesses. We need to understand as a population that our largest strategic weapon in the defeat of this virus is our behavior. Behavioral changes, even if it is made by most, can be completely sabotaged by just a few who choose to disobey the rules. Every individual needs to understand their direct impact on the progression of this pandemic. As I indicated, the CMO asked that I highlight the core principles again that are contained in these guidelines. And for all the guidelines, the core principles are the same. Social distancing practices, frequent and adequate hand washing, surface and facilities sanitation, respiratory hygiene with the use of face masks as well, and procedures to address sick employees and for those who are unwell to stay at home. Social distancing will be a fact of our life for months to come, so we need to do it smartly and as efficiently as possible. Social distancing can be done in two ways. Spatial distancing, which is the separation of people in space, the moving, for example, of workstations further apart would be termed a spatial distancing measure. Whereas temporal distancing is the separation of people in time. So the slide that is on your screen shows a number of individuals who are leaving work. In the first column, which is in my left-hand corner, you will see all individuals are leaving work at the same time and there's no social distancing between them. This is a situation that we do not want. In the second column, on the other upper quadrant, you have social distancing by space, meaning that every individual stands 6 feet apart. This is sometimes difficult depending on the square footage of the area allocated. So for example, if you have a company that is sending 50 or 60 employees to lunch at the same time, the lunchroom area may not be able to accommodate the required 36 square feet per individual. So what you can do is temporal spacing, which is shown at the bottom of the slide, where you choose time slots and allow smaller groups of individuals to have their lunch periods at different times so that you can have both spatial as well as temporal distancing. Besides using spatial and temporal distancing, we can also further the spread of this virus by restricting the number of different individuals we encounter at one particular time. And this is called group distancing. And so, for example, if you have an institution where you are manufacturer, for example, where you have packaging, you have primary processing, you can allow these individual groups to work together and do not mix with other groups. This helps in two ways. One, it restricts any infections to a particular group. And as you are well aware, if we have a positive case in a business, then all those who are deemed to have had contact with that primary case will need to go and be in either stay at home for 2 weeks, and that can have a disruptive influence on that business. So if you have group spacing, what will that allow? You will allow just one group of individuals who will be affected, and your entire business will therefore be able to run once sanitation measures have been implemented. Second slide, please. It is important to note that from a population standpoint, you need to have at least 80% of individuals involving themselves in physical distancing and social distancing to have an impact. And so if only some of the population engage in social distancing, it will not have the desired effect from a population perspective. And so this is very important, especially now in this season, as Minister indicated, we have a lot of people who may be gathering at different places, and we want to ensure that while they gather, they socially distance. The other main core principle is that of frequent and adequate hand washing. It is important that individuals maintain hand washing regularly, and especially when they engage in certain activities. For example, when one uses the washroom, one eats, drinks, removes a face mask, those are times that you need to wash your hands especially. You also need to ensure that when you enter places like supermarkets, both on entering and exiting, you wash your hands or use an appropriate hand sanitizer with the 70% alcohol. Respiratory hygiene is also very important. And you, as mentioned previously, if you have a cough or sneeze, you should cough into the crux of your elbow. And then if you have a tissue, dispose of that tissue immediately and then wash your hands. Droplet infection is the means by which this virus spreads from one individual to the next. And that is why the wearing of personal protective equipment and face masks are so important. Face masks assist when social distancing and other protective measures may not be feasible. One of the problems we have noticed is a sense of complacency when wearing face masks. Next slide, please. As this slide indicates, a lot of people think that if I am with my colleagues, I can speak without a mask. This is very common. In my office, for example, I have to frequently remind people when they come into the office, they wear a mask, but then when they are sitting at their cubicles, they no longer feel the need to wear that mask. And so they speak to one another, people who they consider as friends or colleagues, without the need for a mask. It is important to note that every individual needs to be considered as if they are a potential positive. We do not know the means by which they are arriving to work, how many pieces of transportation. I have one worker who works in Mount Hope who comes from Fullerton in Cedars and has to take 3 different taxis to get to work. And so during that time, that person can be exposed and develop an infection and therefore transmit in the workplace. Another thing that we have as a familial form of exposure is within families. And we're not talking about your own household, but we are talking about family gatherings with people from different households. Recent research from the United States, and this may not be applicable here, show that the 5 top areas or hotspots for spreading coronavirus are bars and restaurants, because there's no social distancing and people do not routinely wear masks when at a restaurant or a bar. At the beaches, again for the same reason. At gyms and at social gatherings where families are involved. It is important to understand that wearing a mask by yourself while speaking to someone who does not wear a mask is also a potential problem. Masks can only do so much, and so it must be used together with social distancing. A recent research from the Lancet that is published in the Lancet, that is a research article, have indicated that if 2 individuals are wearing masks, even if one is a carrier of coronavirus, then the transmission possibility is low to negligible, as opposed to if only one person is wearing that mask. Obviously, if both individuals are not wearing face masks, then the transmission possibility is very high. Cleaning is also very, very important. Yesterday, I visited an establishment, and I noted that the only person, and this was a large car dealer unit in San Fernando, the only person that was wearing protective equipment within the establishment was the person who was involved in cleaning. All the workers in the office were not wearing face masks. In fact, they were talking to one another as usual. People from the outside who worked in the garage area were coming into the parts area and speaking over the protective barriers directly to their counterparts without wearing a mask. And so this is something that we need to look at. Despite having a very good policy, before I entered into the establishment, I had to take my temperature, wash my hand, and I would not be allowed entry without a face mask, but everyone in the establishment was not practicing the same. And so it's important that we adhere to these guidelines. Cleaning procedures need to be documented. They will help also in your business continuity planning. Very importantly, we should try to have on, for small businesses or medium-sized businesses, a contracted agency in the event that our plan doesn't work and we do have a positive case within our establishment, some external company that is registered for doing deep sanitation for COVID. And if we have those persons readily available, we will be back up and running as soon as possible. As we mentioned before, sick employees, anyone who is sick, and we know of the case of the person who was a delivery driver who was sick and then visiting many establishments. If you are sick, especially showing signs of COVID, you need to stay at home, call the hotline, and get tested as soon as possible. We all have a predisposition to think that it won't happen to my family or to me or to my friends. All the other people, and we see other places in the world, the misery that is taking place, the amount of cases that are in other jurisdictions. I urge everyone to take the time also to reinforce positive behaviors. This is important. Wearing a mask, doing social distancing is difficult. Thank your grocers, the person who is bagging your groceries, for wearing a face mask and for keeping to what we are recommending. With respect to business contingency planning, it is important that businesses consider setting up a dedicated team that will report and meet on these issues. Ensure that the team has cross-representation from all the areas of your business. It is important to assess the impact of your operations. What will COVID have if I have a case and I need to be shut down? How can I compartmentalize my operations? So, for example, if you are a poultry processor and you're supplying restaurants, can I do large storage at an alternate site and have a dedicated staff so that in an event my primary processing has a positive case and I need to close my establishment, I have a backup of supply that I can supply my customers with. Identify critical groups of employees within your establishment, those that may have a special skill set. Try to see how you can train others so that in the event that one of these individuals is quarantined, then you have a backup plan. Ensure work at home systems are running well. This is very important. A lot of people think that if you're working at home, you are given special privileges. But in this time of COVID-19, it's important to set up work at home arrangements and make sure that you have proper reporting. Also make sure that you have property security systems in place to avoid people working from unsecured networks from your business from being hacked. Talk to your critical suppliers. Your suppliers may also be affected by COVID, and then your raw materials may not be able to be accessed. So you also need to stock up as much as possible on critical supplies. We are seeing now, even in the health sector, problems with getting supplies in on a timely manner as we had before. It is important that you establish clear protocols for regular and emergency communication, both with your employees and your stakeholders, and evaluate what the government is doing to support your business. There may be grants that may be available, tax concessions, whatever that is available. Take take a great use of these so that your business can stay afloat. I thank you for your listening and for your cooperation, and I hope that if we all cooperate, we can get through this together. Remember, we are in this fight together, and we all need to do our individual part to make sure that we stop the spread of coronavirus. I thank you.
Thank you very much, Dr. Rahman. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. And we want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. And once we have completed the poll and time allows, I will come back to you. Let us keep this in mind as we begin taking your questions. TV6.
Hi, good morning, everyone.
Morning.
Good morning. So going back to the numbers, we have 356 active cases in our parallel health system at the moment. right? The capacity of the parallel health system is between 900 to 1,000 persons. So my question is, at what stage are we going to roll back restrictive measures, seeing that we are close to 50% capacity? And I'm sure those numbers will be increasing within the coming days or weeks. And my other question is, we've admitted that there is some level of complacency occurring, and we're seeing within certain demographics there's an increase based on age and activity and all of these things. On March 29th, we had 76 active cases and we were implementing lockdown measures. On August 8th, we have 100 active cases, 356 active cases, and yet we are just asking people to wear masks, practice social distancing, and all these things. But why the difference between a controlled imported case and sporadic spread? What is holding back the Ministry of Health from cutting back on certain activity? And when is it going to happen? Looking at the numbers.
Okay.
CMO?
So I could start it. Dr. Richards could possibly go into a little more detail into the numbers. But just for clarity, we have 66 persons in Cora, there are 20 persons in Couva, that's 86, and we have 12 persons at Root. Those are the active cases that we have. So that's a total of, I believe, 98. Yeah, so 98, not 356. 356 speaks to the total number of persons using the parallel system, including those who have been quarantined. Okay, so the active cases are 98 at this time. The definition of clusters and sporadic, as you looked at phase 1 and phase 2 going forward, the WHO classification, as we know, has 4 levels of classification for a country. So this is a country, Trinidad and Tobago or any other country. So we go in terms of no spread, so there's no cases. There's sporadic, which we were at a few weeks ago, where you have cases coming up in different locations from time to time, not linked to each other, not forming clusters. We have, about a week ago, we made a recommendation to PAHO to change our definition from sporadic to cluster, meaning that we have conglomerations of local cases or imported cases coming together in a specific geographic location and or that are linked to each other. So when we looked at the map that I had up before, it spoke to some large clusters in certain areas. We were able to link quite a large proportion of those clusters to persons, although they may be at different geographic locations. So for now, we maintain the cluster spread. Community means that there's extremely widespread spread throughout the entire country, meaning that you can go to any locality in the country and possibly be at the same risk of developing COVID. That's not the case at this point. However, we continue, it is a continuum. So we continue to look at the numbers, where they're coming, see if there's an epidemiological link every day to determine if that definition going from cluster to community needs to change. Bearing in mind community in the arbitrary, not WHO definition, we have local cases, we have cluster cases that have come from the community, not using the community definition from WHO. So we have to understand the difference. The community that WHO refers to, it is an epidemiological profile that a country has to meet and criteria has to be established. And Dr. Hines will continue to look at it with his team and make recommendations as to if and when we reach to that stage. And when he comes in next week, we will again look at that issue in a little more depth when he provides us with the updated charts, and we can discuss it a little further. In terms of the recommendations that have always been made with regards to rolling back or rolling forward certain initiatives, releasing, that continues to be made. We continue to make recommendations as needed, and those, as Dr. Rahman indicated, the primary goal at this time is to get persons to take personal responsibility for their behavior. We ask that there's an individual level of responsibility that has to happen, with particular reference to social distancing and wearing of masks, which are essential. We have seen countries in other parts of the world have a fully open society, and because of 90% compliance with wearing of masks alone, as a single public health measure, they were able to drop their caseload to very insignificant numbers. So we need to practice the new normal, which are the public health guidelines, to an extent until we get a vaccine or a specific treatment to this virus. So we need to learn behaviors. We can't be punitive every time we see a few cases come up here, there, and everywhere and close everything in society. It has to be measured and it has to be taken, but we are trying to create a behavior change in the population. Without the behavior change, even if we roll back, there will be clusters and will be continued spread in the country. So what is the biggest weapon we have, as Dr. Rahman indicated? So wear our masks, physical distance, hand washing, and all the other public health measures. And we have seen in a number of the cases that we had thus far, the breakdown has occurred because persons have chose to go to work or to go to school while they are ill. And it is one of the most important public health guidelines to abide by, because it leads to the greatest number of persons being impacted by our being in environments of different types. So we need to stay at home if we are ill. So we need to learn to live the new normal and practice all those things as much as possible to decrease the numbers in the population. We can't be rolling back and forward different parts of the society every time we have a few cases. So we are keeping a very close eye on it, and recommendations will continue to be made if we think that that is relevant. Okay?
Thank you. Dr. Richards, you have anything to add?
I would just like to add that at present in the parallel healthcare system, we have 4 levels of care. And with the critical, given the number of positive cases that we've had recently, the critical area would be looking at hospital beds and step-down facilities. At present, we have approximately 415 hospital beds available across 4 hospitals. And of course, right now we have 66 persons hospitalized plus 12 en route. So that's 78 out of 415. The step-down facilities would be the other rate-limiting factor, because when someone is well or they are asymptomatic, they would be transferred to the step-down facilities until they complete their time period, which would be approximately 14 days, or until they receive 2 negatives. And at present, we have 20 persons in the step-down facility. The total capacity of the step-down facilities, if we went single occupancy, is 120. So that gives us an example of the proportion of persons in the 2 limiting or the 2 factors of concern, which would be hospital beds and step-down facilities.
Thank you very much. TTT?
Good morning. Crystal Wilson, TTT. I have 2 questions for the CMO. My first is, given this morning's clinical update and the batched positive cases recently received, can you say whether there is the possibility that these people did not self-quarantine, moved around, and possibly contributed to the increase in cases that we're now experiencing? And my second question, given this second phase, it appears to coincide with the reopening of bars, and given the younger age group affected, has it been determined as yet whether or not there's any connection to them visiting bars, or is it still too early and an investigation still has to take place? Thank you.
Okay, so in terms of your first question, it's a very good question. So we have indicated to our county medical officers of health, once a swab is taken for COVID-19, that persons are asked to self-quarantine at home until a result is received. And we're asking the population once again to abide by those regulations. It is really to protect everyone, so that if we learn that in a week or a few days that you are positive, if your movements are restricted, we decrease the possibility of community spread. So that's a good question, and we just want to remind everyone that once you have a swab for COVID-19, that you await the negative result before you continue on. And even if you don't have COVID-19 and you have a viral illness of some type, we want to reduce the risk of any virus spreading in the country, and the same remains. You don't go to work ill, you don't go to school ill. So we ask that you stay home until your viral illness abates, even if you get a negative test. So in terms of your phase 2, the epidemiological links, as Dr. Hines would have indicated on Wednesday, there have been established links to bars in a number of cases where we saw positive cases being at bars. Still to be determined whether they would have picked it up from any interaction with the staff there or any other patron there. So that connection has to be made. But there's certainly a link between the attendance of bars of more than one individual, recent attendance, and their positivity. So that is happening, and that is being seen in terms of the epidemiological trend that we determined, that we looked at so far.
Thank you. ACP News?
Harry, AZPnews.com. I was going to ask about the lag in the testing, but I think the CMO answered that. But CMO, I wanted to find out from you. There have been a lot of rumors last week, the past days, that you contemplated resigning or you have resigned. Can you just give us an idea where those things come from, and is it a general feeling that maybe you are asking for more rollback measures, and you are not being listened to? I don't know if you could shed some more light on that for us. And one last question: we haven't seen the Minister of Health today. Can you tell us why he's not here? And we wanted to find out about the incident at the ministry this morning. So I don't know if you can shed some light on that. Thank you.
You go first, CMO, that after.
Oh, so as you know, I'm still here, right? So since the time I was appointed CMO, I have never submitted any resignation to anyone. So I hope that clears it up once and for all. I think we got a number of false resignation social media posts coming out since April or thereabouts. I think the last one most recently. So I never submitted a resignation letter to my PS or anybody else during that time. All right.
Okay. Prior, just want to confirm, yes, that there was a fire early this morning at the Ministry of Health head office. No one was injured, and actually the fire services, everything is under control, and the relevant authorities are conducting investigations.
Minister Diaz.
All right. With regards to the Minister of Health, well, you are aware that the season we are in at this point in time, and the Minister of Health is very confident of his health professionals, so that's why they are here today, and he's not. Thank you. 98.1.
Good morning to you, Minister Cox, and doctors. Stephen Cummings here, 98.1 FM. Just two areas quickly, one for Dr. Parasuram and the other for Dr. Richards. First, Dr. Parasuram. Dr. Parasuram, is there a preferred way to exercise when engaging in physical running along tracks and savannas, for example? One person complained to me about people actually running in opposite direction with close contact, on mask, and with the possibility of the emission of droplets. So, that person is a bit fearful with that kind of activity. And Dr. Richards, a policy position was taken to maintain an 80% threshold capacity against the background of not wanting to further stress test the parallel healthcare system with cases. I'm wondering if with the recent discoveries, and many under investigation, that we might be in some danger of now having to go beyond that 80% capacity threshold, or is it that you are going to continue to maintain that 80%? Thank you.
Okay, so in terms of the exercise question, the most critical thing when you exercise outdoors where there may be other persons, for instance in a savanna, is that you maintain social distance. Some persons have even indicated, based on research, that we try to double that 6 feet when we go into open spaces where there may be propagation of the droplets by air, etc., and heavy breathing from exercising. So I think the most important rule is to have social distancing. Some people have chosen to wear face shields and those kinds of things so that they don't have impediments in their breathing, which of course helps to some extent as well. But I think the most important thing is that we have enough social distance between you and the person who is also exercising in that space. So we don't want anyone coming very close beyond the 6 feet.
Okay, let's take in the other part of the question.
The Ministry of Health would continue to maintain an 80% occupancy across the parallel healthcare system. Of course, that would depend on the level of care that is currently in place. And this is important to ensure that other mitigating factors that may affect the particular level of care are maintained. We plan to really have a transition system in that through rapid testing and diagnosing and follow-up of our patients, we would be able to, for example, step patients down. So if we have a patient, for example, in the HDU, we plan to have them step down to a ward level, and then once they are well enough and they don't have much comorbidities, a patient will be stepped down to a step-down facility.
Okay.
Thank you very much. We go to Newsday. Newsday.
Good morning. Hello, good morning.
Good morning.
We've had some concerns expressed by businesses people thinking that possibly they've been getting fake calls from health officials during contact tracing. Have you heard of any such reports? And what should official contact tracing look like for people who use it?
Hold on, we're not hearing you clearly. We're not hearing you stay clearly. Could you repeat your question, please?
There have been reports from businesses about issues with contact tracing. They've been getting phone calls, and they are concerned that possibly it could be fake. Have you heard of any such reports? And what should official contact tracing look like?
Okay. All right. So I have not learned of any report, but we'll be happy to investigate if you have further details relating to those incidents. The persons, as I said, responsible for contact tracing, we have 9 CMOHs in Trinidad. There's 1 in Tobago, and those persons are the focal points for contact tracing for the whole country. So any concerns can be relayed to the offices of the CMOHs. If you have, or myself, if you have names of persons calling in and you think that they are not officials from the Ministry of Health calling in, but persons will be contacted by phone in most cases. There may be some visitations of workplaces from our public health inspectors, sometimes our nurses and doctors to do contact tracing. So those are the normal parameters that occur.
Okay, thank you. Express?
Good morning, Camille Hunt Express.
Good morning.
Dr. Parasuram, I understand the National Health Workers Union has written to you outlining concerns with the potential exposure of staff at the Mount Hope and San Fernando hospitals. Have you received their correspondence? And if so, can you address the issues that were raised? And also, can you clarify the procedure for hospital workers who are determined to be primary or secondary contacts of a positive case? Because the union is saying some workers were identified as contacts, but they are still required to go to work rather than being quarantined.
Okay, so up to Friday afternoon, I haven't received that letter from the union as yet. I will look out for it first thing on Monday morning to see if I have received the same. But bearing in mind, the RHAs, North Central and Southwest, would be approached to determine if we have any incidents of that occurring. Of course, the ministry will be looking into it to see what is happening. Our protocol for contact tracing is very detailed, and it depends on the level of exposure that a person may have. So for primary contacts, a primary contact is a person that would have had more than 15 minutes of exposure to a case, a known case, being in less than 3 feet away. So that's the WHO definition, and which we have applied here. So both persons possibly not wearing masks. So once that definition is met, you are a primary case, and we expect that you will be home quarantining. So anyone that meets that definition will be home quarantining. Sometimes there are secondary cases, and there's varying situations that may occur. A secondary exposure is an exposure to a primary case, right? So if a primary case, in a lot of times we test the primary cases first. So if those primary cases come back negative, it means that the secondary case, or the chance of a secondary case becoming positive thereafter, the exposure level is extremely low, the risk is very low. And a lot of times, not only in the healthcare sector, once your primary contact is negative, the secondary contacts are allowed to go to work and mingle using your mask, making sure that you continue to monitor yourself for the 14 days. And of course, if you get any symptoms, you let us know, and then we will, through the CMOH office, we'll do the necessary swabbing as it becomes necessary. But certainly, if you are primary contact, you need to be in quarantine for the 14 days. If you're secondary contact, you await confirmation of a negative from your primary or confirmation from your CMOH that you can leave your quarantine before you do so. Okay?
Guardian Media Limited.
Not hearing.
Are we not hearing you?
Rafael John Lal from Guardian Media Limited. Are you hearing me now?
Yes, we are. Good morning.
Morning.
Did we lose him?
Mm-hmm.
Okay. But we'll go back to 98.1. I see that there 98.1, you have another question?
Yes, yes, Minister. Thank you so much again for the opportunity. Dr. Rahman, I just want to address this question to him. Now, I raised this question very early in one of these press conferences. Now, I see now that the WHO, the World Health Organization, has returned to investigating animal hosts for COVID-19 and to ascertain how the disease would have jumped from animals to humans. Now, I understand the argument that we still don't have that cluster of cases, critical mass of cases in Trinidad and Tobago, where COVID-19 is concerned in comparison to other countries. Would you say, Dr. Rahman, that whether or not we are in fact, despite that, making some kind of significant progress or achievement in identifying zootonic sources of the disease as it relates to animals? Thank you.
Dr. Rahman?
Okay, so as mentioned early on in previous conferences, media briefings, COVID-19 has been shown via analysis of the genetic material from that coronavirus to have a link to a set of viruses that were circulating in bats in China. Now, since then, we have had cases of transmission from humans to animals. So there the transmission of the virus to the tigers in the zoo. There were some cats that showed up positive in different places of the world. And as a result of that, we are seeing the zoonotic aspects of this disease from positive human cases to their animals and companion animals that may be with them or animals that they work with in the case of the zoo in New York. As a result of that, what the Ministry of Health has taken in collaboration with the Ministry of Agriculture, there are many repatriating citizens who do have pets with them, and they have applied for those animals to come back into the country. Currently, we have suspended the granting of import permits and license for pet and companion animals to accompany these individuals back home until such time that we have the ability. Number one, the Ministry of Agriculture at this time doesn't have a separate quarantine facility for pet animals, and definitely our quarantine sites that Dr. Richards has mentioned will not be able to quarantine pets with their owners. So that is one thing that we're doing here. From a research standpoint, we have not, and we have colleagues in the university who have been, one of my close colleagues is currently doing her PhD on bat viruses. We have not identified viruses of the nature that was seen in Wuhan that are circulating here in Trinidad. However, there is something that I must mention. There's a research that has shown that humans have actually, in some places in China, transmitted those individuals who are positive, transmitted to bats that were living within the house. And so that is a new development. And I don't think in any of our quarantine sites that we have positives, we have any problems with bats. It's not something that we need to look at right now, but that is one of the new developments that is occurring internationally.
Okay, folks, we are almost out of time, but I just want to go back to Guardian Media Limited to give him the opportunity to ask his questions. Guardian Media Limited.
Yes. John Lance, Guardian Media Limited. Are you hearing me now?
Yes, we're hearing you.
Hello, are you hearing now?
Yes, we're hearing you.
Hello.
Okay.
Well, I think that we are hearing you, but you're not hearing us.
You hearing me?
No. Are you hearing us? Okay, you'll have to send your questions because we are out of time. We've come to the end of today's virtual media conference, and do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. And as we go, I would like to appeal to those who are liming and socializing in public spaces to please observe the public health guidelines. As you know, 2 or 3 bars are now connected to active COVID-19 cases, which also contributed to the outward spiral of the virus from a primary contact into public spaces. What this means is that we are not following the simple but effective public health guidelines meant to protect us. This action of daring poses a threat to all. I understand that culturally, we enjoy liming with each other, but this cannot be at the expense of the rest of the population. So please let us be responsible and lead by example. We simply cannot afford a further rollback of some of the eased restrictions, and therefore, we must follow the public health guidelines in order to stop the spread of the virus. Today and tomorrow, even as political parties make their final appeal to voters, our only request is that you not congregate or assemble in large groups or organize large groups of persons to walk around neighborhoods. Your actions can either protect or endanger us. I am Donna Cox, Minister of Communications, and I thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe, save lives. May God bless Trinidad and Tobago.